Hello, 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 everyone. I'm gonna let everybody start coming in the room. I hope I can see everybody. I can't find my glasses, so it's kind of hard. We're gonna wait for Dr. Cadet to come on. Dr. Maggie, she's a rheumatologist out of New York. And I gotta make sure that this thing does not fall. And we will wait for her to come on and bring her in. Thank you everybody for joining so far. If you have any questions for the doctor, so when she comes in, I'll have them ready. If you have any questions for her, come on in and put those in the, here we go. Yes, here we go. Take those questions and put them in chat box for me. Dr. Maggie, we're waiting on you to come on in. It's getting you in.
Hi.
Hey there. How are you?
I'm good. How are you?
I'm so happy that you're here today.
I'm wearing my purple. We're
There
ending
you
the month.
go. I love it. I love it. I love when people know. You gotta wear that purple.
At least it's a good color. At least it's a good color.
It is. It's a gorgeous color on you.
Oh, thank you. Thank you.
I'm so happy that you decided to join us. I was just gonna go through some just regular information before we start.
Absolutely.
So I just wanted to let everyone know that, we're going to be talking with Dr. Maggie Cadet. Am I saying that correct, Dr. Maggie?
Today.
Cadet? Okay.
Yeah.
See, I had the
My
Cadet.
whole
I
life
had
is
that.
today, tomato, tomato. It's all right.
All right. I want to pronounce it the way you supposed to.
Oh,
So before we just get started, I just want to let everybody know that everything that we do here is just for educational purposes,
yeah.
and that any advice that we give you here, make sure you check with your doctor first, and make sure that you're understanding that we're not holding Lupus in color or Dr. Cadet in any type of how do you say it? See, I just got a lupus fog just that quick.
No,
We're not
yeah,
going to hold anybody
not
responsible.
this is a to spur a discussion that you can have with your physicians. Ultimately,
Absolutely.
has different immune systems, different scenarios, comorbidities. So every patient is different. So you have to discuss it with someone who really knows your history.
Right. Exactly. So I want to make sure that everybody understands that we are just giving you discussion with your doctor. Understand. Questions, please put them on there in the
Okay, are we
comments section.
back?
There you go. There you go. That's
Okay.
fine. That's fine. Everybody is on live, so
So I
so
know it's
so
been
give us
a
a
little
little.
crazy.
It's been what?
It's been a little crazy with technology. Everyone's just adjusting to using the
Yeah.
old.
Yeah, it's all right. That's all right though, because that's why we just sit here, we wait, and then it comes right back.
Exactly.
So tell us a little bit about your practice first, and then we can get started with our myths and truths and start
Yeah.
talking about some real good stuff.
So I've been in practice for over 12 years. I did my fellowship training at NYU Hospital for Joint Diseases, which has a big focus on rheumatology and especially lupus in women. So it was a great place to train. And since then, I've worked in both academic centers where there's been research conducted, clinical research, and also now clinical practice. So I've done both aspects, and I've seen, obviously basic science research, enroll patients in research, but I also feel that in the community, it's also great to be a physician that can relate to patients and see patients
Absolutely.
in clinical practice and really help to take care of patients, educate them, and also involve them in their care. So it's a little bit different from an academic center.
I
And
got you.
I practice in New York City. And, again, I do a lot of work with other organizations with education. So that's a big area of my focus now, because I've seen that so many patients, especially minority females and minority men, are not equipped with the knowledge to understand the scope of their disease and really how
Absolutely.
it can get.
Absolutely, absolutely. That's very, very true. It has been a mission of mine to actually really educate people, especially our people in our Black communities and things of that nature, because we're kind of uneducated about certain diseases, and that might
Absolutely.
be because we just haven't been exposed to it that we
Exactly.
know of. You
Absolutely.
know.
And part of it, I mean, I get a lot of patients who come in who say, you know, they've had symptoms for a while and people dismiss their symptoms for something else.
Mhm.
Others to have no clue about what even, you know, lupus or other autoimmune diseases are. So again, they haven't been
Absolutely.
exposed to it. And again, they are not aware of the complications. So again, we talked about in the Black community and minority community, Hispanic, Latino, Asian Americans, where there might be a higher incidence of hypertension, diabetes, all this heart disease. They all tie into autoimmune diseases in some aspect because of chronic
Absolutely.
inflammation. So if you can get those under control, you may help prevent the complications of some autoimmune diseases as well.
Absolutely, absolutely. I wanted to touch on something, and I knew this was going to happen. We say we're going to discuss one thing, but then our discussion begins to branch out to something else. But I wanted to touch on something that you stated, that you said about actually getting a proper health in our communities, and how can we talk a little bit about the disparity in healthcare that might prevent us from being properly diagnosed in a correct and timely fashion.
Yeah, yes. So, you know, obviously with the coronavirus pandemic, a lot of health disparities in the healthcare system has been exposed. And it's something that we've
Mhm.
for a long time, but I guess with the pandemic, it really has shed a light. So many of my patients, they might be essential workers, they may have jobs where, they don't get healthcare benefits, so they don't go
Mhm.
see the doctor. B, they may not have the financial stability to take off work to actually keep up with their
Mm.
get their blood pressure checks, get their diabetes, sugars in control. So a lot of this has to do with that. Then again, there's exposure to education. Again, sometimes being dismissed if someone does, come in for a visit and they're seen with high blood pressure. There are, times where maybe they're not aggressively taken care of or aggressively educated, so that way their blood pressure medications is changed or
Right.
diabetes medication is titrated more aggressively. So those may
Right.
be
Right.
some of the health disparities. And again, also too with our community, it's also, I do feel that it's great when people in our community do see doctors that look like them, that can relate to
Right.
them. You know,
Mhm.
you can have family members that have the same issues and you can speak to them. It is important, again, whether it's autoimmune diseases or regular, medical healthcare issues, that it's
Right.
important to see someone that can relate to you and speak with you. And I think that's also been, it's been an issue because even as a Black female physician, we only make
Right.
2% of the population in the medical community.
Wow.
So it's
Wow.
something that I'm really working on as well because, being a mentor for medical students or
Right.
residents can help maybe increase the number of Black physicians, especially
Right.
female, in the healthcare community. So those are just some of the health disparities or the reasons why I think it could be an issue
Right.
that these issues not addressed early. And then
Right.
also,
And
go
say it one
ahead.
more time.
And also too, I have spoken to also men, Black men too.
Mhm.
Sometimes they are not comfortable going to the physician, for whatever reason. They wait for a while before they seek help.
Yeah.
With lupus,
Yeah.
men don't get lupus very often, but when they do get lupus, it's severe because by the time they get to the doctor, they've already had complications.
Right.
So it's always
Right.
dialogue that they should seek help. They should feel comfortable seeking help.
Right. Right.
Again,
Right.
being educated.
Yeah, and that ties right into the first myth that lupus is a woman's disease. And you touched on it. When men do make up what 5% of the cases of lupus, and when they do get it, it's a little more severe. And I
Yeah,
think that's an important point that you stated, that they wait so long,
exactly.
because it's difficult. You know, it's really difficult. Like, someone said, you know, I've talked to many people that stated, oh, well, lupus comes along because of one, two, three things, or single cause, or anything, or something like that. Talk to us about, you know, how is lupus determined, and how do doctors work with you to know your health history and the medical history and things of that nature to really determine that you have lupus?
So number one, lupus can be triggered by multiple factors. Sometimes the cause is unknown. There is a genetic component that we're seeing because lupus can run in families. It could be hormonal because most women do get lupus and they're usually in their childbearing age. So we do suspect that there is some kind of hormonal factor or even factors on like the X chromosome, which determines, the female gender propensity. Infection can trigger lupus because again, because lupus is an autoimmune disease, our body or our proteins or immune system fight our own organs because they're recognizing as being foreign agent.
Right,
So
right.
again, it could depend on what your medical history entails, exposure to infection, or whether you already have a weakened immune system. And then we also know that sunlight, so UVA and UVB light, it can be also a trigger for lupus because sometimes when we do get sun damage, there are damaged cells on our body, and then again, the immune system will attack those cells and then start a inflammation cascade. So that's why it's very important for lupus patients to have UVA and UVB sunlight protection. So those are just some of the factors that can contribute. Again, sometimes we just don't know. Now, in terms of working with your physician, it is important that when you go see your rheumatologist or even your primary care physicians, all medications are reviewed because there are some medications that can cause drug-induced lupus. Some of them can be high blood pressure medication. Sometimes it can be like medication for tuberculosis. So again, reviewing the medical history and being honest about it is important. Patients have to do their part too and be honest about their medical history. From there, you also take a full history and exam. So the history is very important because we will ask about fatigue, again, any rashes, chest pain, shortness of breath, other symptoms. That can be something else, but again, can also fall into lupus. And then lastly, there are blood tests that are done to help confirm or not confirm lupus. So with lupus, sometimes in autoimmune diseases, it may take a while to get diagnosed because sometimes your blood work does not turn positive initially. There are proteins in the blood, one of them being an anti-nuclear antibody that is usually seen in almost all lupus patients. So that's one test that we do, but it can also be seen in other diseases. So it's not specific. The other test is a double-stranded DNA antibody. So these are long words, but know that there's specific tests that can point towards lupus specifically. And that's what we use to measure like disease activity or help make a diagnosis. And there's a few other proteins as well. So in combination, the American College of Rheumatology has guidelines as to how physicians can make the diagnosis and for patients to check to see if they may fall in that category.
Exactly. Awesome. Awesome. That's good information because a lot of people have said, a lot of people say so much to lupus patients. And most of the time it's someone that doesn't have the medical degree to really give proper information. So that's really good education for that information.
Just
Another thing, and you
like
go ahead, you
sometimes
can
it
go ahead.
not get diagnosed right away. So that's the other important thing to do. It's important to follow up because a test that's negative on day one may become positive in month 3 or 4. So going back to the rheumatologist or physician to recheck those blood work, if you have a couple of other symptoms, it's very important.
Yeah, absolutely. And knowing your family history, that needs to be something that people really start to think of as well, correct?
Absolutely, because not only they don't necessarily need to have lupus, but if they have another autoimmune disease like rheumatoid arthritis or Sjogren's syndrome, even multiple sclerosis or thyroid disease, these diseases run together a lot. And so if one family member has another autoimmune disease, there's a possibility that you might be at risk for, you know, lupus or another autoimmune disease as well.
Right, and that's a good point, because I had maybe 4 or 5, of course, of the criteria, but once I delved into my family history, I realized that my father died of scleroderma. So, and it all, you know, it all starts to really come clear when you know your family history as well.
Yes, especially scleroderma. Again, there's certain diseases that, again, run together with lupus. Scleroderma, one of them, rheumatoid arthritis, Sjogren's. They share very similar features and similar blood tests too. I mean, they all have their own unique differences, but again, there are some common symptoms among them.
Right. Now I see a question. You answered one of the questions that was there, and it was like, can it run in families and things of that nature? So we answered that one. But there is a question on here that says, can lupus fully go away? I'm assuming that they're asking if there's a cure.
Right. So there is no cure. However, currently, it could change in the future.
Right.
Lupus can go in and out. So, you know, you can go into remission. That means when your disease activity is quiet. So for everyone, that's different. Again, there's not one type of lupus. You can have mild lupus, moderate, very severe lupus. You can have life-threatening complications, or someone can just have skin lupus. So it can go in remission with the right medications, you know, stress reduction as well. But again, knowing what your triggers is important. Again, some people's stress is really a bad trigger for them. They know the minute that they're stressed at work or with family events, something will happen or disease activity will kick up. But you know that medications can help you quiet down your disease activity or go into actual remission.
Right. Absolutely. Can I think there's a myth out there that says, oh, you can cure your lupus with a diet. You want to touch on that?
Yeah.
We know diet has a really important effect as to what our symptoms are.
Absolutely.
But can it really cure lupus?
So with diet, the diet is a lifestyle change that is to help you, prevent comorbidities like heart disease. So we now know that with lupus patients, heart disease is a huge complication of lupus from many factors. What is the medications you're on, like steroids, that can increase your risk of diabetes and hypertension. Also, a lot of patients, there are chronic proteins that are secreted in the inflammation pathway that can also contribute to heart disease. So when you want to incorporate a healthy diet, it's to help prevent, you know, heart disease issues, strokes, as well as other, you know, comorbidities like diabetes or hypertension. Also, it can also lessen the stress in your body and can help with the immune system. So it's an adjunct, but I can't say that only a diet will cure lupus. You know, there are medications that target the actual inflammation proteins that can cause lupus. So that's you're trying to get to the heart of the reason why you may have inflammation. And sometimes that involves blocking chemicals. That's done with medication.
Right. And then, you know, the specific medications that you're talking about is like Plaquenil, Cellcept, things of that nature. I know that I'm personally on Ballista, which is the infusion. So there are certain medications that definitely help to block those issues and, you know, help. If you have a good diet, it definitely helps you in your, you know, managing your symptoms and things of that nature. Now someone asks, will they be using Plaquenil all of their life?
So we don't know, actually. So we do know that hydroxychloroquine and Plaquenil has been studied in lupus patients, and that medication has been shown to actually increase survival in lupus patients. Again, it blocks certain chemicals in the inflammation cascade or immune system. We also know that's why it was being, you know, touted for coronavirus, you know, symptoms. But we do know it specifically for lupus patients, it does help. You do have to be careful in terms of there are risks for heart irregularities or heart arrhythmias. So please let your doctor know if you have an underlying heart condition. We also know that there is eye toxicity or retinal toxicity that can happen if you use it over many periods, over many years, and the dose that you use. So again,
Okay.
getting a yearly eye exam is important. And
That eye exam is horrible.
I, I usually get it at least maybe twice a year, right? Because you
Right.
want to catch something. If it does start to develop, you could just immediately stop it. And most of the time, it can be reversible. So just be aware that Plaquenil is a very good drug for lupus patients. It has some side effects, but for the most part, patients do well on it. But you do have to look out for, again, the heart irregularities, the retinal toxicity. It can cause myopathy or muscle problems in some patients.
Yes.
In
Mm-hmm.
certain patients in African American descent, they may have something called G6PD deficiency, which is an enzyme deficiency that won't metabolize as well. So again, having a conversation with your doctor, checking these things are important.
Wow, that's good information. I didn't even know about the whole toxicity and everything like that, and not being able to absorb it. I guess it's similar to any drug that you take, that
Absolutely.
it's hard to absorb. Do you think that the melanin in our skin makes it difficult, or is this just something that happens?
I mean, with this G6PD deficiency, it's an enzyme deficiency. So it's something innate in your body. The other, we don't know yet. We just know that there are these irregular heart rhythms. And again, even Caucasian individuals, Asian Americans, Hispanics, they are at the same risk. So it's not just particularly to minorities in terms of the
Gotcha.
toxicity. So, it is a good drug, but you have to be careful. And I guess now the biggest question is the supply, given,
Mm-hmm.
the coronavirus pandemic. So make sure you speak with your doctor, maybe get a 3-month supply up front with refill.
Right.
There are especially pharmacies that give you up to 6 months sometimes. So I would
Mm-hmm.
at least take initiative and, make sure you have your supply, because the good thing is Plaquenil does stay in your body for a while, so it doesn't immediately go away, but you don't want to be left without it for too long.
Right. I got you. Very, very important. Now, there are some people on here that might be new to lupus.
Mm-hmm.
Um, what do you tell your patients as far as taking medications and outweighing the pros and cons, outweighing how the the actual drug can help them as opposed to what the side effects might be? How do you talk to them about that? Because I know a lot of people that contact me that are new are
Yeah.
afraid to take the medications. And how do you just give them some, I guess, comfort in knowing that it's going to be okay? It's something that's going to be more positive than negative in your life.
Absolutely. I mean, they are definitely justified in their concern. If I was taking a medication, I would want to know exactly the same thing, the risk of taking the medication. I think it's important for these individuals to have conversations with their doctor, analyzing the risk and benefit ratio. So as you said, if lupus is left untreated, it can really cause severe
Right.
damage. It can cause, again, heart disease, heart attacks, strokes. It can
Mm.
cause kidney disease that can, obviously require a kidney transplant or dialysis. It can cause, antiphospholipid syndrome, which is another coexisting condition that occurs when there are multiple clots in the organs. So a stroke, a lung clot, a blood clot. So I always tell patients, especially young patients, yes, there are risks with medications. There are many medications available. So you don't have to take one or the other. You can go through the list of medications. As you mentioned, there is Plaquenil, hydroxychloroquine. There's something called Imuran or azathioprine, which is used for kidney disease and lupus activity. There is Cellstep. There is also Ballista. There's
Mhm.
Rituximab. There's,
Right.
there are so many medications. Each individual does not fit in one box. So you have to go through, if you're a young female, who wants to have a kid, you
Right.
will not be on, methotrexate or Cellstep or possibly Cytoxan or cyclophosphamide, which is a chemotherapy agent, because it can cause birth defects. If you're an older person without any major comorbidities, that might be an option. So you have to list your medical conditions. But I do tell them, we sit down, we go through the list of medications that are possible for them. I will often have them like take a day to review the medications. Like I'll print out some information from the American College of Rheumatology website that has done really a great job to speak in layman's term for patients, so they're able to understand. And we will have another conversation if they feel that, you know, really hesitant about the starting medication.
Right.
If it's something really serious, like they're having kidney failure, kidney problems, or, you know, heart disease, then it's something that started immediately. And then again, you weigh the risk of having a heart attack and possibly dying right then and there, or being started on medication. So it's risk benefit analysis for each individual patient. But know that you can be scared. It's like diabetes, right? Diabetes, you have medications that have side effects. High blood pressure, these are lifelong diseases, but you have to pick one. Otherwise the alternative is, you know, morbidity or you know, or really bad, you know, mortality.
Yeah, it's really important for us to be honest with our doctors, and for our doctors to be honest with us. And if we don't feel comfortable having those conversations, maybe we need to rethink where we're going to see this doctor. You know, I do find that a lot of people are starting to say that, you know, the doctor's not really communicating well, or it could be just a personality conflict that really, you know, happens. And that's normal. We're all human. It's going to happen. But that communication portion is very, very important. Now, I know a lot of people talk about the different vitamins that can be taken and can't be taken. I know for me, certain vitamins, certain herbal remedies I can't take, you know, elderberry and things, echinacea. It just does not do right with my body. And I've read that it's not good for autoimmune diseases anyway, because it stimulates the immune system. Could you talk about that whole piece about, you know, what are the good vitamins for us to take, and what are the things that we might want to just stay away from?
Yeah. So I will be completely honest with herbal medications. I personally don't prescribe them or advocate, just because I don't know what it will do to that person's immune system. So many times, and again, you don't know where you're getting it from, who the manufacturer is it 100% pure? Is something else being mixed in? And how will that relate to your immune system? What I do, you know, tell my patients that they can take is like a multivitamin. You still want to keep your immune system up and working properly. So vitamin D, know that a lot of patients with lupus, have low vitamin D levels. We know that vitamin D is very critical in immune function. And if you are on steroids, you have early bone loss. So taking calcium and vitamin D, if there's no other major contraindication, is something that patients should really consider. Also, if you're thinking about pregnancy at some point, like taking something like folic acid, some patients have B12 or folate deficiency. Those those vitamins and I think I will like advocate or tell patients that I'm comfortable having them take. Also, making sure they have basically their electrolytes are okay, like magnesium levels, potassium, and that can easily be, accomplished by just eating, bananas or some other just food sources. Vitamin K, things that help with clotting. So again, you can get a lot of these things in healthy eating. And that's something I always encourage my patients. It's not always a quick fix. I know it's easy to just, take a pill, pop a pill. But again, we just ended up, actually today, I think ends Lifestyle Medicine Week. And it really is a lifestyle change, because you're going to have this for the rest of your life. Even if you go into remission, it can be triggered at any point. So it's really making a lifestyle change so that way you keep your blood pressure controlled, you prevent kidney disease from developing, and you just keep your immune system functioning as well as it can be under the circumstances. So again, just eating a good diet, leafy vegetables, things with fiber, high fiber, lentils, nuts if you're not allergic, as well as omega-3 fatty acids. Like, you could get that in, fatty fish and other supplements. Those are things that I will support.
Yeah. And I think it's important what you stated is the lifestyle change, because once you're diagnosed with a chronic illness, everything changes. Your mindset changes, your body changes, and your lifestyle has to change. And you have to do the things that
help you to be better,
Exactly.
in order to feel better.
And you have
Absolutely.
to talk to your physician about it. And I understand it's hard because I have a lot of patients. I have friends who deal with autoimmune diseases, and I see them struggle. I know it's hard to walk, to move, to
Yeah.
exercise. And I think I just posted this the other day. It's every little step counts. So if you're not able to walk 2 miles, it's okay. Go in your backyard, do, 20 steps, just try to do a little bit at a time. If you're not able to move that much, at least, modify your diet so you don't have to exercise, so much. So it's everything in conjunction really does help.
Right, and that goes right into the next statement that we were going to talk about, and that's just doing things that are healthy for you, that help you just be even beyond the physical. What do
Yes.
you suggest that people begin to do mentally? Because with chronic illness comes depression, comes anxiety, comes panic attacks.
Yep.
All this stuff comes at us, and coupled with the side effects of the medicine, it can be so overwhelming. What do you suggest to anybody who has a chronic illness that they do to help their mind stay healthy and help their mind to help their body to stay healthy?
Yeah, absolutely. So actually, I did this workout program a few weeks ago with a girl, Tune at Peloton, and she was doing something with Venus Williams.
Oh.
She said something that really struck with me. She said, "Your mind is your strongest muscle," which is true.
Mm.
You have seen so many people overcome such challenging situations just because they had a great sound mindset.
Yeah,
And really,
absolutely.
it's true. Like with chronic disease, it's something you're going to be dealing with for the rest of your life, and you have to change that mindset and make yourself as strong as possible emotionally and mentally. So number one is, like you said, find a physician that you can communicate with, because it doesn't matter if you are not having a good relationship with your physician. It's
Right.
not going to work, because you're not going to want to take medicines. You're not going to listen. The physician will get frustrated. It's just not going to work. So that's number one, is find someone that you can communicate with and have a good relationship with. B is tell your family members and your friends about your disease, because a lot of times people may feel ashamed of the disease or they don't want to burden someone. But if someone doesn't know what you're going through, they won't be able to help you. So be honest
Right.
with your friends and your family. And I understand that may be difficult sometimes, and that's why there's so many support groups out there. I really, like Lupus in Color, like your organization, Lupus Chick Official, I work with them very closely. Lupus Foundation of America, Lupus
Yeah.
Research Alliance. There really is so much support out there where they have support groups, they're doing walks, they're getting active, you're relating with people that are like you, that can understand you. That in itself, I think, is a huge support, knowing that you're not alone struggling with this. Three, I think yoga and meditation, it really has helped. I mean, I'm a runner. I did yoga. I started a few years ago, and it really has helped in terms of joint flexibility. Again, you don't have to do an hour, do 15.
Right.
Now all these apps, Peloton, they have like 5 to 10 minutes a day, and just being able to get centered and realize what you need to do to combat this disease and take that time out can help a lot. So there's so many, there's meditation, there's yoga, Pilates is good. There's the Calm app. There's so many resources. But I do think it's something that you have to make time for, right? Because we always say we don't have time for this. Take a walk. Take a walk. I live by the water, so take a walk for 5-10 minutes. That in itself can help you. Journal. Tell people how you feel. Create your own website. Do a newsletter. These are all
Yeah.
things I think can bring fulfillment to you and others.
Absolutely, because sometimes I think that people believe that the healing is in the cure, when the healing might be daily doing things to make you feel better day to day. So that's awesome. Yeah. And we we try to give a lot of people different ways to do that. We do chair yoga, we do Monday meditations. We try to make sure that the whole mind and body is complete, and it is ready to really tackle this whole chronic illness stuff, you know? So that I love that. That's very good information. There was a question in here that I definitely wanted to ask. How come steroids is a big part of lupus treatment? Being young, it's always been hard with the side effect. For example, of course, the moon face. We've all had it.
Yeah. So honestly, when I first learned about lupus, I was a medical student, and I met a young female who was diagnosed with lupus, and she was in her 20s. She had no idea what lupus was. And honestly, I was a medical student, so I was just starting to learn. And she was placed on steroids, and she ended up passing away because she really didn't realize the importance of steroids and other medications that were needed. And one of her complaints, rightfully so, she was a young 20-year-old female. She complained of the weight gain, the moon faces, the irritability, the mood changes.
Yeah.
So I get it. It's real. And as a young female, who wants to deal with that? And who wants to, physically, it's a challenge to, maybe feel beautiful when you have the weight on your face and your body. The thing about steroids is it's not great for long term, but in some cases it's needed depending on what disease you have. Steroids do help with lupus activity. So the same way that hydroxychloroquine blocks certain chemicals, steroids do the same. They block a certain chemical or chemicals that are involved in the immune system. And the great thing about steroids is they can work quickly for a lupus flare. So instead of having your lupus kind of prolong itself in terms of a flare and get worse, steroids can act to maybe decrease the amount of time you're in a flare. Again, it's not something that you want to be used ideally for chronic, but you may need higher doses at first and then go down. The other thing with steroids is it depends on what you're using it for. So if you have minimal joint pain, most physicians may not give you steroids. But if you have a kidney disease, if you're starting to have like problems with your urine, blood in the urine, if you started to have neurological symptoms, if you start having problems with your blood in terms of like severe anemia or low platelets, then steroids are indicated. So I understand as a young female or young male, the challenges or obstacles with using steroids, but with lupus, unfortunately, it is a medication that's been proven to work. You just have to work with your doctor to try to get you down on a low dose as quickly as possible. And if you are on a long term, there are medications to help at least prevent opportunistic infections. So those are infections that are caused when you're on a drug like steroids. So PCP pneumonia is one of those things that we think about as a doctor. So if you're going to be on steroids for longer than a month at a dose higher than 10 milligrams, then you should maybe talk to your physician about being placed on prophylaxis medication for that.
Interesting. I always say that when I was on prednisone, it was a blessing and a curse, you know, because it made me feel like Superwoman, but it made me look like the Stay Puft Man, So, it's the same thing, outweighing the pros and cons of the medication and how you want to feel. Exactly. Awesome. Now, let's talk a little bit about COVID-19, because what I found is that a lot of our symptoms for lupus are similar symptoms to COVID. And, how do we determine, whether it's a lupus flare, whether we need to go see the doctor? How do you tell, your clients how to determine that?
Yeah, so I actually just wrote about this a few weeks ago. So you're right, absolutely right. Lupus and COVID sound very similar. You can have fever, you can have joint pain or muscle aches. You can have some kind of, GI symptoms. With lupus, you can have, again, maybe more joint pain, joint swelling. Coughing is not really seen in lupus flare unless it's rare and you have something called pleuritis or pneumonia, but most of the time it's really not seen. The extreme fatigue can be seen in both. Fever can be seen in both, although with lupus sometimes it goes up and down, maybe not consistently high. The respiratory symptoms, I think, really distinguish the COVID-19 symptoms and lupus symptoms. But now we're also finding out that there are skin lesions. So again, in COVID-19, you have the COVID toes and these other skin lesions.
Right,
They don't
right.
look like lupus, but again, lupus, you can have skin lesions as well. Also clotting. So now they found like some patients have clotting in COVID-19. And we know with lupus patients, they're also at risk for antiphospholipid syndrome. So I tell my patients, they call me, I listen to their symptoms. I can have, but with lupus, you can also order blood work, right? So some of the blood work that you can order include like the white blood cell count, which goes down with lupus, or your platelets go down. Sometimes that can be seen with infection as well, but more so with lupus. You can check the urine to see if there's any development of kidney disease. There are also things called complements. So C3, C4, they're part of the immune system. They go down in lupus, but they can also go down in infection. And also other lupus specific labs. So as a rheumatologist, I would order those labs. Even if you're doing telehealth, you can, the rheumatologist can order the labs and you can get that done. And then it can determine whether this is something really acute that needs to, that you need to go to the hospital for. And most of the time, again, if you have respiratory symptoms, most of the time they'll see if there's like a pneumonia, a COVID-19 pneumonia, that's a possibility in terms of the differential. But the symptoms do sound very similar. And I'll send you that post. I did.
Yeah, please do. Please do.
It's very similar. And again, that's why having a physician that knows you well as well can be helpful, because they know what your lupus flares look like. Again, just isolate yourself. At this time, I'm telling my patients, if you don't need to be out, you don't need to go out.
There you go.
Everyone's on lockdown. I know even as things start to open up, you don't need to go to the grocery store. Get it delivered if you can, as much as possible, or go early in the morning when the lines are not long. But I would continue the same strategies at least for another several months before I start to relax as a lupus patient.
Right. And that was the next question I was going to ask you, is that, the mask and things of that nature, is that something that, lupus patients really need to start thinking about using. I know I use one anytime I go with other people. I have my mask on. It's important to me, I guess.
Yeah, I think I would say, again, going forward until there's a vaccine, and again, we have to see what the vaccine looks like. Is it efficacious? Is it safe in patients? Again, lupus, patients and autoimmune disease patients have their own immune system challenges. So we're gonna have to wait for that. But wear a mask. Everyone's wearing a mask now. No one's gonna feel out of place. Just wear it. And again, right now is the best time to not socialize. You could, socialize on social media, FaceTime, Zoom, but there's really no need to really be in a large gathering, or even like the park. If you gotta walk, you can walk nearby your apartment or, residence. You don't really need to be exposed to a lot of people right now while things are not under control.
Absolutely. I totally agree with you. I think this is a scary time for anyone that has any type of chronic illness. But we understand the whole isolation because we've had to do it ourselves, so it's just kind of extended more for us and things of that nature. Now, as far as being isolated, a lot of our, chronic illness warriors, they are isolated alone.
Yeah.
How can they reach out? What do you advise that they do as far as trying to being alone and not being lonesome and having that depression and, the anxiety set in?
Yeah, I agree. It is very loathsome for a lot of people. I do find that, obviously the mental health, we just finished up Mental Health Awareness Month. I think New York State has been doing a great job with opening the lines of communication about mental health awareness. And there is a hotline for people feeling lonely or feeling depressed. I do feel like with technology, it's been a blessing, because think about if we were going through this pandemic without any technology. The fact that we do this right now and speak about this and people are, able to join in the conversation is really important. So again, there's on Instagram, social media, Facebook, there really are so many support groups and people having discussions almost daily about autoimmune diseases or mental health. So I would just get online, even if you're not actively participating in conversation, but join in on their live events, listen to what they have to say, join in on the, you know, all the people out there who are doing exercise regimens
Right.
and routines.
Right.
You can feel like you're part of a community without being at the gym. And honestly, it's safer, and it's been so great because you get to see what's out there. They have yoga, strength training, again, meditation. It really is, I think, a blessing that we have technology, because I'm sure there would be a lot more isolated people in this world going through it if we didn't have the technology we have.
Absolutely. Absolutely. Someone had a question. I'm trying to find it. Let's see. That's absolutely so true. I love the online
Yeah.
workouts.
Great.
Because, I feel like I'm really in the gym, you know.
Oh yeah, and
Oh,
that's really great. And it's like you're not, you know, at least think about this for arthritis and lupus patients. You spend all this time worrying about traveling and being again in contact with people on public transportation or elsewhere.
right,
With all these workouts at home, you don't need to do that, and you save your time and energy. So
right.
again,
And your money.
yeah, I hope this stays. I really do. I really hope that for a while we don't completely get back to what we were
Yeah.
before.
I think we as people need it, and I
Yeah,
think the earth needs it as well, because we know
yeah,
environmental factors also can affect, lupus patients and things of that nature. So I think that we all need it. I'm enjoying quarantine. I hate to
me
say it,
me
but
too. Me
I'm
too.
good with
I
it.
like it.
So someone asked, does Ballista affect if you have vascular problems? I think that was the question she had.
Yeah, so Ballista is a medication that's it targets it's a antibody, a human antibody, and it does help with moderate lupus. So we still are trying to figure out the extent. It's been used for nephritis or kidney disease, but for vascular problems, you know, steroids are still used, cytoxin is still used. They're still studying those parameters in research right now. So time will tell, but again, there are criteria for Benlysta as well. Not every
Right.
patient is qualified to use Benlysta or, you know, able to use Benlysta, but it's definitely been a promising drug. And there's also Rituximab. So Rituximab has been used for other types of vasculitis. That is something, it targets B cells. So, you know, B cells are these certain types of cells that produce the antibodies or the proteins that attack our body. So if we can eliminate the B cells and eliminate the proteins, then you may not have these antibodies circulating in your body attacking organs. So that's what that does. So again, that might be something you may want to speak with your doctor about, possibly Rituximab. But
Well, I
vascular
think
problems is also different. Like vasculitis is different from vascular. Vascular involves like the artery and things like Raynaud's. I'm not sure if people have heard of Raynaud's, where there's a problem in your circulation and there is less blood flow to the digits, and you can get like digital ulcers or other major problems. So you got to distinguish what you're really targeting.
right, and it really goes back to having a proper conversation with your doctor,
Yep.
and really trying to figure out what the right cocktail is for your body. Um,
Yeah.
how do you a lot of times it's kind of hard for people to go in and say, doc, I've been reading, and I know I'm not a doctor, but I've been reading, and I'm trying to figure out, I've heard about Ballista, I've heard about CBD oil. How should they go in there and ask these questions without offending? I'm sure that some doctors do get offended,
Yeah.
if we're going in there telling them what we read off Google Doctor. So how do you suggest that they go about talking to the doctor about changing medications and things of that nature?
Well, I always say, like, as a patient, it is your right to do the research, to get the education. It's, and then it's the physician responsibility to either dispel the myths or have the conversation of why they may not be a medication for you or why it may be a possibility.
Right.
I personally don't mind when patients research, because honestly, it's their bodies. They have to make the decision ultimately to take the medication or not. So if they're not having a conversation with me, or they feel like they're not being heard, they may be less likely to engage in their healthcare and engage in their disease management. So I just always say, honestly, I can only speak for myself. As a physician, this is part of the job. So as a patient, if I went in to see my own doctor, I would do the same. If I read something or found out something, it's the physician's job to really speak to why or why not that medication is an option or not an option. So I think as long as you are respectful and you say, I read about this or I heard about this, what are your thoughts? It should not be a problem for the physician.
Right. I agree. Unfortunately, so many people are having that issue. And like I tell them, find another doctor. If they're not going to listen, if you can't communicate, I guess you got to find someone else that you can communicate with and have a conversation about your health and be an advocate for your own health.
Exactly.
Absolutely.
And be a fit. Like every again, like it's like a relationship. Every doctor cannot fit you for whatever reason. It could have been like you both had a bad day, or there was a communication problem, or it really doesn't matter. It just, at the end of the day, you're going to be with this physician for a while, so you have to pick someone that you feel comfortable enough discussing these important issues with.
Right. And one last question that was sent to me earlier, and I'm going to read it. Can lupus affect your teeth and your gums?
So we do know that with lupus, there is another disorder called Sjogren's syndrome that can be seen with lupus. And that is, with Sjogren's syndrome, again, you have antibodies attacking the secretions, like from saliva, vaginal secretions, secretions in your mouth. And that can cause dental caries or cavities because there's less blood flow, less saliva flow to those areas. So yes, because that's something we do pay attention to. And also to chronic inflammation can cause gum disease and periodontal disease and periodontitis. So again, even with RA, we do know with RA, rheumatoid arthritis and Sjogren's syndrome, that's documented. There is a relationship between oral activity as well as inflammation or systemic inflammation. I always tell my patients as well, go get a bi-yearly dental exam, and especially if you're on steroids, that can there's problems with that too. So yes, it can.
Okay, thank you. And we're wrapping up Lupus Awareness Month. Do you have anything that you want to share with us? Some encouraging words for lupus awareness, lupus patients and anybody that really has a chronic illness that you would like to share?
Yes, compared to so many years ago, lupus right now is such a hot area of research. There's so many organizations, like again, the American College of Rheumatology, Lupus Foundation, your groups that are really helping with advocacy, helping with support. We are definitely making strides in terms of medications for lupus. Like right now, as I mentioned, there are options. You do have options for lupus treatment. If you fail one treatment, don't get discouraged. There are others. Also, too, for women with lupus who are trying to plan a family, you can do it. You just have to speak with your doctor about getting your disease under control for about 3 to 6 months prior to pregnancy. And then you can pursue that option. But there are females who do have healthy pregnancies, or they have quiet activity during the pregnancy. There's maternal fetal medicine doctors. There's so many specialists. And also, too, in the United States, a lot of the big academic centers like NYU or Hospital of Special Surgery, Johns Hopkins, they have great lupus clinics as well. So if you're able to get to those clinics, they specialize in lupus specifically, but also lupus in pregnancy. And, rheumatologists, we do work together with so many specialists to help really coordinate the care for lupus patients. So you can live a long and healthy life. I would just, again, want people to keep in mind that heart disease is a very big complication of lupus. So we talked about this in the beginning, getting your lifestyle in order, making the necessary changes to ensure that you have proper diet, exercise is crucial. It's not about just the joint pain or the muscular pain. It really is about preventing heart disease, strokes, diabetes, obesity, because those will lead to morbidity and mortality.
Absolutely. Thank you so much. It
No,
has been such a pleasure talking to you. I'm so glad that we were able to get together and talk about all the myths and the facts and get your input on everything about lupus. I'm so excited to be able to collaborate with you with this specific event. And I hope that we are able to do something else later on as well.
Well, thank you. Thank you for all your work and getting people involved and getting them excited to be their own advocate, because it really, it's a two-way street. It's not just the physician. It's got to be the patient too. So we'll write this down, and for people who missed it, we can talk about myths, and I'll post it on my Instagram too, at Dr. Maggie Cadet, and they can take a look there as well.
All right, let them know where they can find you on the internet as well as social media.
So social media, it's Dr. Maggie Cadet, C-A-D-E-T, spelled like cadet. And I do have a website as well, www.maggiecadetmd.com. And I'll put that it's on my Instagram actually. So you can, I blog about lupus, like medical facts and patient stories and patient accounts. So again, it's always about the patient at the end of the day.
Right, which is important. I love it. Thank you so much, everybody, for tuning in. Thank you, Dr. Cadet, for coming on, and we hope to see you again soon. And everybody, you all have a great day. Take some time to just be you and just be and meditate and get your mind right so you can fight this lupus very well. Exactly. Thank you, Dr. Cadet. We'll talk to you soon.
Okay, bye.